If you have chronic shoulder pain, especially here in the front of your shoulder, you may want to consult with a specialist before trying any specific shoulder exercise or treatment. Bicep tendons have been known to rupture spontaneously. Notable examples of this would include John Elway, the famous football quarterback. Interestingly, John Elway says that he felt better once his tendon ruptured, finally releasing all of the painful tension in his shoulder. For more on that story, make sure you watch this video here. Welcome to the Shoulder and Arm Health channel, where we discuss the latest and best in shoulder and arm health. I've been on a quest to discover the best exercise for preventing shoulder problems. Especially since people are more active than ever, we need to find ways to combat the seemingly inevitable tendinitis that forms in the rotator cuff and the bicep tendon. It may have been coincidental, but something happened to me that uncovered a new discovery. About a year ago, I was having pain in my knees. A doctor friend of mine recommended I check out the knees over toes guy on YouTube. I learned his exercises and it worked. My knee pain went away. So I talked to a doctor of physical therapy to ask him how these unique exercises worked. It became clear that the exercises used several principles that actually make sense, one of which was contracting the muscle while stretching it to the maximum of its range. These types of exercises induce changes in the muscle, allowing it to gain pliability, reducing the resting tension in the muscle. I wanted to see if we could apply these same principles to a super common shoulder problem called bicep tendinitis. This is probably the most common problem I treat, and on a personal note, I've had it twice in my right shoulder and twice in my left, so I was really motivated to see if we could find a fix for both for myself and for my patients. The bicep tendon curves sharply as it enters the shoulder. This killer curve is where all the rubbing and irritation takes place. Excess tension in the bicep muscle as well as poor scapular mechanics can worsen the rubbing, leading to more pain. So the challenge I was facing was, how do I put the bicep muscle under maximum stretch so that we can then contract the muscle starting from the most stretched position? So a lot of people think that the bicep muscle is mainly affected by your elbow position. So if I actually extend my elbow, yes, I can extend my bicep or I can stretch my bicep, but that only does about half of the stretch that's involved. To get the other parts of the muscle fully stretched out, you actually need to extend the shoulder. And the reason is that same diagram I showed you earlier where the bicep tendon curves over the top of the shoulder. So to get that bicep maximally stretched, we've actually got to extend the shoulder beyond the plane of our back. So to start this exercise, you need to start with your feet just in line with the plane of the door frame. You don't want to have your toes too far in front of those or too far behind. At first you want to have your feet just right here. You also put your hands right on the door frame itself at about waist level, like I'm doing right here. And to start this exercise, I think it's best to have your toes about this far apart. Put your hands over here, and as you put your hands against the door frame, you'll feel some pressure on your palms. Now lean forward from this position and you'll start to feel a stretch in the front of your shoulder. And you can see my elbows are mostly straight, my shoulder is extended, now my bicep is under maximum stretch. And from that position, that's where we start to push ourselves back to the starting position. So that's how you get your bicep under maximum stretch. Starting from that position, we're going to apply pressure with our palms and push ourselves back. You have to be careful not to use your feet or your calf muscles to push yourself back to the starting position. You actually will use your hands and you're going to be pushing that bicep just like the knees over toes guy does with his quadriceps under max stretch. We start from here and right then we initiate the motion pushing ourselves back to the starting position using our arms, which is essentially using your bicep muscle and a little bit of the shoulder itself. So I'm going to show you that one more time. You put your hands right here at about waist level and you lean inwards like this till you feel that stretch, and then you'll push yourself back up to the starting position like this. It's okay to bow inwards at the waist. So I'll show you the third rep. We're going to bring our arms all the way back to here, and from that starting position, I'll hold it there for about like 5 seconds and then initiate the return to the starting position from there. And then you'll repeat this. You can do this like 10 times in a row. And again, you shouldn't be having a lot of pain when you're doing this. You'll feel a stretch. You may even feel like soreness, but if you're feeling pain, you're doing it too hard. So after you've graduated from just the basics with your toes right here at the front of the wall, you can actually increase the intensity of the stretch just by inching your toes back like 2 inches from the wall. Again, starting with your hands in the same position, if you now lean in, you'll feel a lot more of your weight against your arms and against your shoulders. As you gain confidence with this and as your shoulder pain starts to subside, you can even start with your feet further back and really magnify the intensity of this stretch. It feels really good because I've been doing this a long time, but you may feel some pain at first. So obviously if you have pain, back it down. You can actually inch your toes forward and you'll feel less of a stretch as you do this. And hopefully that'll get rid of the pain that you were experiencing, because you have to be able to do this without pain. If you have a lot of pain either during or else the next day, what I always tell patients is that'll usually make you feel like you need to take it easy, like take a rest day. Then you start going backwards. So always stay under the bounds of pain, and you'll be able to make incremental progress. I'm going to show you that one more time, this time using some exercise straps. It's essentially the same exact exercise, but I think it helps to demonstrate the exercise better when you can see it from the side. So I've got my exercise straps here attached to the door frame, and I'm going to basically have my hands low like this, and being aware of my foot position, I'm going to lean forward until my shoulder and my elbow are pretty straight. I'm going to use my bicep power then to push myself back up to the starting position. And once I feel no more tension, that's far enough. And then I'm going to lean back into it. And it's okay to pause and linger here for, say, like 2 to 5 seconds. Bring yourself back to the starting position. And one more time, bring yourself all the way down, feeling that stretch in the front of your shoulder, and then using your biceps to push yourself back to the starting position. And you can see here the position of my body changes significantly. If I bring my toes forward, it's a lot easier stretch. If I bring my toes backwards, I'm going to be leaning a lot more forward in this position. Again, I want to emphasize that it's okay just to use a door. Door frames are everywhere. You can use them at work or at home. But if you have a set of these straps, it can also help you to get a little bit deeper into the stretch. If you're interested in the forces that are at play here, muscles are known to actually change at the cellular level in response to certain types of exercises. With active stretching and eccentric loading, which is what these are examples of, the muscles are stimulated to add contracting units called sarcomeres. Think of these as little train cars all in a row. Now there's definitely a use it or lose it component to sarcomeres. If you don't stretch the muscle loses those little train cars, leading to a stiff and overly tight muscle. And the converse is true. If you actually use and stretch, you will add those, which also reduces the resting tension in your muscle. I have personally experienced a big improvement in my own shoulder health by doing these exercises every day. My shoulders feel bulletproof when I'm doing these exercises. Also, since it is easy to adjust the intensity, the exercise is possible for anyone at any age or at any level of fitness. Please leave me a comment and let me know if this stretch helps you. Also, if there are any topics you want me to cover, please let me know that as well. Thanks, and I'll see you in the next video.